So this is a freshly milled CAD-CAM milled titanium bar. It's a screw retained titanium bar. This is the underside of the bar. So this is the pterygoids. These are the two nasomaxillary buttress implants placed in the canine region. These are the two implants placed in the anterior maxilla next to the incisive canal. The incisive canal is quite big. That is why the implants are placed a little far away. And if you observe, there is no implants placed between canine and pterygoid. The reason is there is no bone. Actually, these kind of cases they need a pterygoid, but however, we are avoiding pterygoid by following certain philosophy and protocol, where we are engaging the important three buttresses on either side. One is the pterygoid buttress, nasomaxillary buttress, anterior buttress, using multi-unit implants, single piece multi-unit implants, not the cement retained implants, and connecting the implants with a titanium bar. So the titanium bar behaves exactly similar to the bone. It transfers the occlusal forces very much effectively. So these implants integrate very well without any disturbance. So that is how we avoid zygomatic implants. Even when a zygoma is indicated, we could able to avoid successfully and predictably. If we are going for a cement retained processes single piece implant, for example hybrid bridge or metal acrylic bridge, then while removing it may create a lot of disturbance, vibration. That is one problem. And if you go for a welding, so doing welding for this kind of a long inter-implant distance, there will be a lot of flexibility in the welding wire and there will be failures. So the more predictable way is using single piece implant, single piece multi-unit implant, and engaging the key buttresses and connecting the implants with a milled titanium bar. So this philosophy we are calling as 3B tie-B protocol. 3B means 3 buttresses engaging 3 buttresses. Tie-B means titanium bar.